I'm Dr. Jeffrey Niezgoda. Here we are in the AZH Wound Center in Milwaukee, Wisconsin. This is a multidisciplinary clinic where we take care of patients with all different types of wounds. One of the basic tenets of wound healing is the understanding that all wounds are hypoxic. We have very little available in the marketplace to provide therapy that's directed at that tissue hypoxia. That would be the delivery of oxygen. Most of us are familiar with hyperbaric oxygen therapy. That delivers oxygen systemically. But can we influence the wound by applying wound in a topical or better yet transdermal fashion and deliver that oxygen in a sustained fashion over time? If we could have a dressing that would accomplish that, we could elevate tissue oxygen tensions above the threshold required for wound healing. We know that below 30 millimeters of mercury, fibroblasts don't do their job. Other cells important in the healing process, such as epithelial cells, again, stagnate or are operating at a suboptimal level, delaying wound healing. What I'd like to do today is introduce you to a new concept, a novel dressing called OxyBand. This is a dressing that will in fact deliver transdermal oxygen over a 5-day period through a very unique and specialized dressing. I'm going to introduce you to that application right now. So as you'll see, OxyBand is packaged in a potato chip-like container. This is filled with 100% medical grade oxygen. That oxygen penetrates the dressing and fills the cavity, the reservoir within the dressing, which then releases its oxygen to the tissues over time once the dressing is applied. Let's give you an example of how this dressing is applied to an actual patient. Once we remove OxyBand from the package, you'll know there's several components. This is the dressing itself. You'll see the reservoir. This is the reservoir that is filled with 100% oxygen. Also in the package are applications that can be used in 4 different wound settings. We have a hydrocolloid topical, we have a thick foam topical, and we have a thin foam. This actually is adhered to the inside of the dressing. Once this is removed, the dressing is activated. The oxygen will come from these small holes from the reservoir and penetrate the wound base. Obviously, if we have a wound that does not have a lot of exudate, protecting the wound base with the hydrocolloid dressing can be accomplished. If we have wounds that have more exudate and we're worried about some absorption, we then have the foam to apply. See, we have different size foams and thicknesses that can be varied during the application based on the amount of exudate found in the wound. So here's our example wound, and you'll see that what I want to do is trim the inside of the hydrocolloid to fit the wound itself. So I'm going to use some of my kindergarten skills and trim the dressing to fit over the wound, like that. I will then remove the backing of the hydrocolloid, apply that over the wound base, and then next prepare the OxyBand dressing. Again, as I mentioned earlier, the OxyBand dressing does have a reservoir that is held apart by this material inside. The reservoir is filled with oxygen during the packaging. Once we remove that back of the dressing, we activate the dressing. We are then going to remove these back strips. This will expose the adherent layer, and the adherent layer is what we are going to apply down over our hydrocolloid. Again, the oxygen will come from those holes. You apply this over the hydrocolloid. It's important that you get a nice seal all the way around the dressing, as you'll notice here. And that is accomplished to seal the oxygen inside the dressing so that it penetrates directly to the wound. We can then remove the tabs from the tegaderm type of material, again sealing that dressing all the way around. We have created a seal over the wound. The reservoir is now activated, delivering oxygen to the wound base through that entry port that we created in the hydrocolloid dressing. I would now like to demonstrate application of the OxyBand dressing on a wound that has more exudate. If it is a dry wound or one that you want to retain moisture, the hydrocolloid works well. However, if you have a wound that is heavily exudating, applying a foam over the wound to absorb that dressing and then applying the OxyBand makes more sense. As I mentioned earlier, we have two different types of foams. As you see in the packaging, we have a thicker foam and then the thinner foam that is adherent to the dressing. Again, once this is removed, the dressing is activated. So we'll peel this off and activate the dressing. These holes that you see here, again, allow the oxygen in the reservoir to diffuse slowly over time, actually a 5-day window, directly to the wound base. So in this case, what we're going to do is we're going to take our thicker foam, we're going to apply it over the wound. This wound is showing more significant exudation, and then we will apply the OxyBand directly over the foam. The adherent side has been opened. We're going to cover that wound with the portals that allow the oxygen to diffuse into the wound, and we're going to secure the dressing in all directions with gentle pressure. And we want to achieve and seal all the way around the wound, as we're doing here. Remove the protective application borders. We've created an envelope around the wound now. As you see, the oxygen in the reservoir is being delivered through that semi-permeable membrane and those small holes you saw on the flip side. That oxygen can penetrate to the wound. It'll go through the foam into the wound base and deliver oxygen over a 5-day period. So I hope you've enjoyed our introduction to this novel technology, OxyBand, the only dressing to deliver transdermal oxygen of a chronic wound over a sustained 5-day period. As you'll note, the OxyBand is very versatile and can be customized to a variety of wounds. We have also found the combination of the foam dressing with the OxyBand over a pressure ulcer provides superior pressure redistribution at the wound site. Excellent for pressure ulcers. Thank you for your attention. OxyBand Transdermal Wound Dressing.